Hello, everyone. In the last video, we have studied about the introduction, several definitions given by different authors, and about major perspectives of psychology, like biological perspective, cognitive perspective, socio-cultural perspective, and so on. We have also discussed about nature and scope of psychology, and in the last section we have studied about branches of psychology, that is pure psychology and applied psychology. From them, we have discussed about pure psychology thoroughly. Now let's talk about the applied psychology. This branch involves the practical application of psychological principles to address real-world issues and improve the lives of individuals or groups. Professionals in applied psychology use theories and findings from pure psychology to solve practical problems in various domains. Examples include clinical psychologists providing therapy, industrial organizational psychologists enhancing workplace dynamics, and educational psychologists improving learning environments. Now, let's talk about its branches in detail. Number 1. Educational psychology. Educational psychology is a branch of psychology that focuses on understanding how individuals learn and develop in educational settings. It applies psychological principles to enhance the teaching and learning processes, addressing aspects such as cognitive development, motivation, assessment, and instructional strategies. Educational psychologists collaborate with educators, administrators, and policymakers to implement evidence-based practices that enhance teaching and learning. By applying psychological research to educational contexts, this field aims to improve educational experiences and outcomes for students at various stages of their academic journey. Number 2. Clinical psychology. Clinical psychology is a branch of psychology that focuses on assessing, diagnosing, and treating mental health disorders and emotional issues in individuals. Clinical psychologists work with clients to improve their well-being, address psychological difficulties, and promote mental health. They use a variety of therapeutic approaches and interventions to help individuals cope with challenges and enhance their overall mental and emotional functioning. Key aspects of clinical psychology include therapeutic interventions, treatment planning, assessment and diagnosis, research and evaluation, consultation. Clinical psychologists often work in various settings, including private practices, hospitals, clinics, and educational institutions. They play a vital role in supporting individuals facing emotional and psychological challenges, helping them develop coping strategies and work towards mental health and well-being. Number 3. Industrial psychology. Industrial organizational psychology is a branch of psychology that applies psychological principles and research methods to the workplace. It focuses on understanding and addressing issues related to human behavior in organizations with the goal of enhancing productivity, employee satisfaction, and overall organizational effectiveness. Key areas of focus within industrial organizational psychology include personnel selection, training and development, leadership management, workplace motivation, organizational culture and climate, occupational health and safety. Industrial organizational psychologists may work in various settings, including corporations, consulting firms, government agencies, and academic institutions. They collaborate with organizations to optimize human resources, improve job satisfaction, and enhance overall workplace effectiveness. Number 4. Political psychology. Political psychology is a subfield of psychology that focuses on understanding the psychological processes underlying political behavior, attitudes, and decision-making. It explores how individual and group factors influence political opinions, beliefs, and actions, as well as the impact of political events on individuals' mental processes. Key areas of study within political psychology include political attitudes and ideology, political socialization, political decision-making, political leadership, group dynamics and identity, political conflict and cooperation, public opinion. Political psychologists use a range of research methods, including surveys, experiments, and content analysis, to gain insights into the complex interplay between psychology and politics. This field contributes to our understanding of how psychological factors shape political behavior and inform public policy decisions. Number 5. Legal psychology. Legal psychology, also known as forensic psychology or the psychology of law, is a subfield that applies psychological principles to the legal system and explores the intersection of psychology and the law. This interdisciplinary area examines how psychological factors influence legal processes, decisions, and outcomes. Key areas of focus within legal psychology include criminal behavior and profiling, witness testimony and memory, legal decision-making, mental competence and insanity, juvenile justice, risk assessment, and sentencing. Legal psychologists may work in collaboration with legal professionals, law enforcement, and other stakeholders to enhance the understanding of human behavior within the legal context and contribute to fair and effective legal practices. Number 6. The military psychology. Military psychology is a specialized branch of psychology that focuses on addressing the unique challenges and psychological needs of military personnel, veterans, and their families. It encompasses a range of areas, from assessing and enhancing the mental well-being of military members to understanding the psychological impact of combat and deployment. The key areas of consideration are combat stress and trauma, operational psychology, resilience and coping, military families, psychological assessment, human factors, and performance. Military psychologists often work within military organizations, veterans affairs agencies, or as civilian contractors. They play a crucial role in promoting the mental health and well-being of those serving in the military and addressing the unique psychological challenges associated with military service. Now let's talk about the methods of psychology. That is, the tools and procedures we use in order to studying the human behavior or psychology as whole. Number 1. Introspection or self-observation method. Introspection is a method of psychological inquiry that involves examining and reporting on one's own thoughts, feelings, and mental processes. It is a subjective and self-reflective approach where individuals observe and analyze their internal experiences, aiming to gain insight into the nature of consciousness. Every method in this segment comes with some specific merits and demerits, so let's talk about them as well. Merits of self-observation method. Number 1. Insight into subjective experiences. Introspection provides a direct avenue to explore subjective thoughts, feelings, and experiences, offering insights into the intricacies of individual consciousness. Number 2. Useful in certain contexts. In fields like clinical psychology or counseling, introspection can be a valuable tool for individuals to explore and understand their own emotions and behaviors. Number 3. Rich description. Introspection allows for detailed and rich descriptions of mental processes, enabling researchers to gain a nuanced understanding of cognitive and emotional phenomena. Number 4. Historical significance. Introspection played a crucial role in the early development of psychology, especially during the structuralist movement, led by Wilhelm Wundt. It laid the foundation for the study of mental processes. Number 5. It does not require any specific apparatus or laboratory, and hence is not very expensive, so it can be availed to people easily. Now let's talk about the limitations of this method. Number 1. subjectivity and bias. Introspection relies heavily on subjective reports, making it prone to individual biases, personal interpretations, and variations in self-awareness. Number 2, difficulty in verifiability. The private nature of introspective experiences makes it challenging to verify or replicate the findings. Different individuals may interpret and report similar experiences differently. Number 3, limited accessibility. Some mental processes may be difficult to access consciously, leading to incomplete or inaccurate self-reports. Unconscious processes and biases may go unnoticed. Number 4, lack of objectivity. Introspection lacks the objectivity and control associated with more experimental and empirical research methods. It is inherently limited in its ability to provide an objective understanding of mental processes. Number 5, behaviorist critique. Behaviorists criticized introspection for being unscientific and argued that observable behaviors should be the primary focus of psychological study. This led to the decline of introspection as a primary research method. Number 6, inability to study unconscious processes. Introspection is not well suited to explore unconscious processes, limiting its applicability in understanding certain aspects of cognition and behavior. Now let's talk about the second method of psychology. That is, the experimental method. The experimental method is a research approach in psychology that involves manipulating one or more independent variables to observe their effect on a dependent variable while controlling for extraneous factors. This method is characterized by its systematic and rigorous design, allowing researchers to draw causal conclusions about the relationships between variables. The experimental method is widely used in psychology to study various phenomena, including cognition, behavior, and emotion. It allows researchers to establish cause and effect relationships and contributes to the development of psychological theories. Now let's talk about some of the key components of experimental method. Number 1, independent and dependent variables. The independent variable is the variable manipulated by the researcher, while the dependent variable is the outcome measured. The goal is to determine if changes in the independent variable cause changes in the dependent variable. Number 2, random assignment. Participants are randomly assigned to different experimental conditions. This helps control for individual differences and ensures that any observed effects are more likely due to the manipulation of the independent variable. Number 3, control group. Experimental research, a control group is often used as a baseline comparison. This group does not receive the experimental treatment, allowing researchers to assess the specific impact of the independent variable. Number 4, experimental group. This group receives the manipulation or treatment applied by the researcher. Any differences observed between the experimental and control groups can be attributed to the manipulation of the independent variable. Number 5, randomized controlled trials, or the RCTs. Experimental methods, particularly in clinical research, often involve randomized controlled trials. RCTs are designed to assess the efficacy of interventions by randomly assigning participants to treatment and control conditions. Number 6, replication. To ensure the reliability and validity of findings, experimental studies are often replicated by independent researchers. Replication helps establish the generalizability of results. Number 7, quantitative data analysis. Experimental data are typically analyzed using statistical techniques to assess the significance of observed effects and draw conclusions about the relationships between variables.